calling the Obama hub. Obamacare's Big Brother database and warns the potential for abuse is staggering. Representative Black joins us. Wow. You don't like it?
Pretty scary.
Well, it's more. I think it probably gets more information on you than perhaps the NSA.
Well, it does have an awful lot of information all in one place. Not that this information maybe couldn't be found currently in other agencies, but there will be a whole lot more that will be collected. But the scary part is it's all in one place. And there's so much inconsistency there. One time they tell us that they're not going to save the information. The next time
Well, John says 10 years.
10 years is now. They told us they weren't going to have our personal health information. Just this past Friday, they came out with a rule that on page 72 and 73 of that rule, it says they will have personal health information.
So it goes beyond your income. Now it goes to your personal health information, whether you've had a mammogram, whether you've had a biopsy, all that stuff?
Well, this will be used to help to match you up with the appropriate insurance policy. So let's say you have a condition such as diabetes and you have an insurance policy that maybe doesn't cover you completely on that. They'll be looking into that to make sure that you're matched up. Is this not scary that we have a government that has gotten so large we don't really know by the rules who it is that really does have the access? Do they have background checks?
Well, I'm not big on background checks, but after Mr. Snowden, it's like, it's really, I'm not sold on the fact that background checks really work. I'm not sold on the government really keeping secrets. I'm not sold on the government doing anything particularly well that way. And now we've got the situation where, well, a lot of Americans may not like their phone numbers kept and who they're calling. Now we learn from you medical information accessed by what? Hundreds? Hundreds of access? Thousands?
Who knows? It's not being identified. And that's the reason why we have sent a letter, or we're drafting a letter that's going to be sent to the IRS and HHS to ask them these very important questions. And then I also am encouraging our health subcommittee and also our oversight committee under Ways and Means to invite HHS in.
What do the Democrats in your committee say about this? Because a lot of Democrats, they don't like the NSA. I keep going back to the NSA. That may not be fair, but they don't like the intrusion into privacy. A lot of them don't, and they don't. It's always a balancing test. But are they disturbed by this?
Well, what we're finding, Greta, is very few people know about this. I tripped over this and doing some reading about maybe 6 weeks ago, and the more that I dug into this, the more scared I got about what's there and the inconsistencies about who's going to have access to it.
Was this written in the original 2,400-page bill, or is this what HHS, with when they added the 20,000 pages of it or regulations, is this written by HHS or is this written by members of Congress?
Well, as John said, there were provisions in the Obamacare for being able to have access to this information. It's not specifically written that it would be the Federal Data Services Hub, but that's what came out of this.
All right, so people we didn't even elect have now done this.
And scarier than that, it's a 2,700-page bill that the commissioner of HHS has still got lots of rules to promulgate from this point forward, and who knows what else they'll come up with. But the scarier thing you'll have to invite me back for is the navigators, and to talk about how the navigators are going to have access to some information that's pretty scary as well.
All right, well, that's a good tease. We'll have you back to talk about that. Thank you, Congresswoman.
Thank you for having me.